Hi everyone. So I'm Athena, or you can call me Ten. So the lecture for today is entitled Speech Pathology Situationing. So before we go into the lecture proper, let me introduce the that we have for today first. So first is to briefly discuss the history of SP in the Philippines, to situate SP in the Philippines through the Filipino SLP survey, to differentiate SP in the national and global scene, to determine the effects of the pandemic on the profession, and lastly, to ponder on what we can do as possible future SPs. So next slide, please. So before let me show you an overview first. So we will be talking about the past, present, and lastly, the future of speech pathology in the Philippines. So for the past, I will be introducing to you the brief history of speech pathology. Then for the present, I will be discussing some key findings from the 2019 SLP survey. And we will also be comparing the national and global scene of speech pathology. And I will be introducing to you how SP has been affected by the pandemic. And of course, lastly, speech pathology in the future. So for the brief history of speech pathology, started in the Genesis years. So the Genesis years focused on how speech pathology as a program was developed and how it started in the Philippines. So it first began as a way to make education accessible for the deaf here in the Philippines, which was brought about by the Americans. Then speech pathology was then proposed by Dr. Francisco Namenzo as a program in the Department of Speech and Drama in the University of the Philippines in Diliman. And significant people like Dr. Guillermo Damian and Professor Rosella Suta Zastro made significant contributions and efforts to make the genesis of speech pathology in the country possible. So next slide, please. Then we have the chances and challenges years of speech pathology. So of course, there were students who had to go through the first few years of speech pathology while it was newly implemented. So it was first implemented University of the Philippines in Manila in 1978. So the development was very unstable, but thanks to a core group of Filipino speech pathologists who helped and worked hard, they made the development of SP very stable. And with that, moving on to the growing years of speech pathology. So in these growing years, after speech pathology as a program was approved in the University of the Philippines in Diliman, 3 more universities offered speech pathology, and those universities will be discussed in the next lecture after mine. So each year, more and more SLPs graduate from these universities, with around 150 to 200 new therapists per year. However, with that number, masasabi pa rin talagang kulang nga talaga ang mga speech with the 2019 Filipino SLP survey. Next slide, please. So the 2019 Filipino SLP survey was an online survey conducted by the Philippine Association of Speech Pathologists with an objective to guide PASP in planning its programs. So here are some key findings. For the demographics, there were 277 respondents, 91% of which were from the Philippines or working in the Philippines, and 9% were Filipino speech pathologists who were working abroad. So the numbers look good, right? So hindi masyadong marami pa yung speech pathologists abroad. Pero meron pa rin na nandoon. So let's take a look at why later. So majority of the current practitioners are situated in NCR or in Luzon, and following NCR is Region 4A and then Region 3. So if you look at the slide here, makikita talagang unequal pa ang distribution ng speech pathologists in the Philippines. So wala masyado sa Visayas and sa Mindanao. So next slide, please. Meron ring mga regions na hindi nga talaga na-reach, and an example of that is ARMM. So it can be found in the slide right there. So next slide, please. So let me present to you the ratio of speech pathologists to patients in the Philippines. So in the Philippines, it's 1:14,286. So if you think about that number, parang okay, wala lang. Pero let's compare it to the ratio that the US has. So the US has a ratio of 1 is to 260. So I don't think I have to further explain kasi nga mas malaki naman talaga ang gap sa Philippines. So kulang nga talaga ang SPs. So with that, the demand for SLPs in the Philippines remains high. So some go abroad, as aforementioned, some pursue medicine, and some are undecided. Next slide, please. However, there are personal reasons naman on why they decide to do that with their lives or with their profession. So some factors include the better pay or salary that is offered abroad, the better quality of life abroad, and the better education and training that they can receive abroad. So this can be attributed to the work profile and the work practice issues in the country. So let's take a look at it in a comparative view in the national and the global scene of speech pathology. So the practice of speech pathology is different in every country. So next slide, please. So the differences in the work profile include the pay and standard of living, how the course program is taught to the students, and of course the practice of the profession. So it's different in countries wherein speech pathology is considered a highly developed discipline, like in the United States and Canada, also in Australia. So for example, in Australia, there are since they have very good funding for healthcare, unlike here in the country, Australia has SP clinics in every block. So it's different here in the Philippines since not a lot of SPs are distributed in the country. Most are situated in Luzon, and the patients sometimes feel very frustrated because of very long waiting lists brought about by the lack of SPs. So I'm not saying this to scare you. I am saying this so that you, as possible future speech pathologists, can also help in the future. But before we go into how you can help in the future, let's take a look at how the pandemic has affected speech pathology as a profession. So the biggest effect that the pandemic brought about to the profession was the shifting to teletherapy. So if you aren't aware of what teletherapy is basically therapy but online. So this shift has brought about a lot of pros and cons. So di ba nga sabi ko kanina, a lot of the SPs are situated in Luzon and mostly are nasa NCR. And most of them, if not great, they have good internet connection. Pero we have to take note of the SPs that are also found in the provinces like in Visayas and Mindanao. And they have very poor internet access. So that also becomes a barrier to effective teletherapy. So the assessment component also becomes very difficult compared to when you're dealing with patients face to face. So, however, despite these cons, there are also benefits that this shifting has brought about to the profession. So, since teletherapy is done at home, there is increase of engagement of parents and or guardians in specific therapeutic sessions. And because there is increase in engagement, the parents or guardians learn more on how to support the patients. So that becomes a very good thing for the patients and the families as well. So moving on, next please. So I've discussed to you how speech pathology has evolved, its past and its present, and its differences from the national and global scene and how the pandemic has affected it. So you might be asking, why is this important to me? Like, bakit ako nandito sa Zoom meeting ngayon? Ba't ako nakikinig dito? So let me tell you. To understand how SP has evolved in the past years, to understand the past and its present situation is a great step towards what we can do for the country as possible future speech pathologists. So this leads us to the last portion of our lecture, which is speech pathology in the future. So what can you do as a future SP? So first and foremost is, of course, to serve the underserved. So sabi ko nga kanina, may unequal distribution ng SP sa Pilipinas. So, you might want to be an SP in the future. So pwede mong ma-equalize yung distribution na yun. And then we have people for research as well. So as I've been mentioning since kanina, SP has evolved a lot and it has changed from an proposed program pa lang to a profession na ngayon in the Philippines. But it doesn't have to stop where we are right now. So you can help by uh, you can help with that in the future through research if you're into that kind of thing. So meron pang mga solutions na kailangan natin na kailangan natin i-solve during this time. Like there are still issues in the key frameworks of the profession and in how the program is actually handled by the universities. So, for example, there is still the lack of a uh, standardized evaluation test for those who speak Tagalog or Filipino only. Because most of the standardized evaluation tests are in English. And you might be the one who will help standardize a test for the Philippines in the future. And of course, last is to help the general public appreciate the value of communication. So, next slide, please. Dr. Marzan's words. Communication is beautiful. Communication makes life meaningful. It's something we don't think about often, but it's something that helps us so much. So people usually take the ability to communicate for granted. So they don't appreciate it and notice its value unless the ability is taken away from them. So imagine not being able to communicate for a day. That might be so frustrating for your part, right? Think about the other people who can't communicate their whole lives. So how frustrating would that be? So communication, we should understand that communication is a pathway to enjoy a better quality of life because you will be able to express yourself and you will be able to interact with a lot of people through communication. So that's it for our second lecture in this culminating activity. I hope you learned a lot and I hope you got even just a little bit inspired. So thank you so much.